Record?
Yep.
Okay. Hi, everyone. So it's good to see you this way. I'm sorry I missed the opportunity to do our normal meeting in the back room there. So I hope everyone's safe and hope you had a good Thanksgiving. It's our favorite time of year, health insurance time. So the plans are up for renewal on January 1st. Couple things. As always, we take a look at the marketplace. The increase wasn't too bad. It was a single-digit increase from Horizon. But we met together, we looked at all carriers, and we thought Horizon was certainly Blue Cross Blue Shield was our best medical plan for the year. Studio Eagle is going to continue to pay 100% of the single rate for the Omnia Silver plan. We're also going to continue to offer a gold plan. There are some of you that want a little bit better benefits. And we're also going to offer a plan with a blue card, which is nationwide, because there are folks that live outside New Jersey who want nationwide coverage. So on the screen, you'll see a memo that I know Amanda passed out. We're going to go over that right now. I'll answer any questions. I will tell you that we thought we made a significant change on the dental. We've had Guardian for a long time, and I think their rates just kept going up and up and up. But now we're offering a plan from Delta Dental, which is less money and a $5,000 maximum. So it's a tremendous benefit, and we're going to change to Delta Dental as of January 1. And then we're going to keep the Guardian plans for vision and also for the life insurance. Okay? So I'm just going to go review the memo with you guys. Obviously, this is written, Amanda, Katie, this is written for you guys that you can hand out to anybody during the year, just explaining who's eligible for the insurance. Little quick summary about the free plans. We're offering the 3 different plans. One is the medical and the prescription. On the voluntary, meaning the employees pay the premiums, this is new, the Delta Dental plan. And then we're keeping the term life, vision, and from Guardian Insurance. So that plan we're keeping. This is just a little overview about the 3 different plans. They all are what's called an EPO, which means you don't need referrals to see specialists. You have to stay in network unless you have an emergency. The Omnia product is, again, one of the most popular ones in New Jersey. There are 2 levels of coverage, tier 1 and 2. We're going to go over a couple of the not too many changes Horizon made to the plan designs, as well as the 3rd plan that is not an Omnia. As a reminder, preventative care, your well visits are always paid at 100% when you use a participating provider. It doesn't matter if it's tier 1 or tier 2. For your annual well visit, it's 100% covered. This is a little bit description in just a paragraph form about the 3 plans, which I'm going to go over in a little bit more detail. Okay? So these 3 plans, proposal 1, 2, and 3, I'm going to highlight where most of you are covered, which is the Omnia Silver plan. The copay has been reduced from $35 to your tier 1 primary to $30. One other benefit that's different is in the prescriptions. While you had a $20 copay for generic medications and a 50% coverage for name brand, they did now put a $250 max to protect you. So where if you paid 50% for an unlimited amount of medications, now you can't pay more than $250 for that month's supply. So they did that because some of their other competitors have a maximum. So that's helpful in case you have a $600,000-$700,000 medication. So that's a protection that says your 50% will never be more than $250. Other than that, you'll see a lot of similarities. The copay that you owe, $500 a day, I will explain that the way the Horizon plan works is you have 2 levels of coverage, tier 1 versus tier 2. If you have major bills like hospitals, surgeries, MRIs, last year's plan had a $1,250 hospital and surgery deductible. They bumped it $50. So now it's $1,300. If you go to a tier 2 hospital, you have a $2,500 deductible, that's the same as last year. So there's a major incentive for you to try to use tier 1 facilities. The 35 was dropped to 30. The specialist copay remains at 60. And remember that you owe 50% if you're going to a tier 2. So there's your incentive to use tier 1. After you meet your deductible, you owe $500 per night at the hospital. And after the 5th night, you don't owe any more. That's exactly the same benefit as it was last year. You have a $250 outpatient surgery copay. That's the same as it was last year. $100 copay to the emergency room after the deductible, exact same benefit. And the urgent care remains at $75. Remember that if you go to the urgent care, you owe $75 copay if it's a tier 1 urgent care versus a $1,300 deductible and $100 copay for an emergency room. So major difference between urgent care and the ER. Point being, from Horizon, try to find tier 1 urgent cares if you can. Okay, so front to back, not tremendous amount of changes for the Omnia. It is still probably the most popular plan purchased in New Jersey. For those of you on the gold plan, you can pay a little extra out of your pocket to upgrade. All of their coverages remain the same. The only thing that I think changes the potential of the out-of-pocket. You had a $5,000 out-of-pocket, now it's $5,400. All that means is when your copays hit a certain number, you don't have to pay any more copay. So this plan is so rich, most people don't come anywhere near the out-of-pockets, but that's really the only change they made to the gold. In summary, for those that were looking at the difference last year and you didn't do it, why you would pay more money for the gold is because your doctor copay is lowered. It's $10, not $30. Your specialist copay is $25, not $60. At the medication, down at the bottom, you have a $40 or $75 copay for your name brand as opposed to owing 50% up to $250. So for some of you, you may be on medications that are very expensive and paying that 50%, it may be more economical to pay a little extra premium and upgrade to the gold. You still owe the $500 copay after the deductible, but the deductible is only $500. It's not $1,300. So that again is part of some of the reason why you may want to upgrade to the gold. Okay. The last plan is similar to what we had last year. It's called an Advantage. The word Advantage is important. Here in New Jersey, there's no tier 1, tier 2. The Advantage is one of their larger networks where you don't have to worry about a tier 1, tier 2 status. You have one level of copays, 40 for primary, 60 for specialist. What's different about this plan, though, it has the word Blue Card in the title. Blue Card means I can see a Blue Cross and Blue Shield provider out of New Jersey at the same level I did in New Jersey. So it provides nationwide. If I live in Pennsylvania, I can see Independence Blue Cross doctors on an in-network level. If I live in New York, I can see Empire Blue Cross doctors. I don't need an emergency to get there like the Omnia plans. There is no deductible for hospital and surgery bill. It's the straight copay of $500 per day. So you're saving either the $1,300 or the $500 deductible. And the pharmacy is a little trade-off because you do owe 40 and 50% for name brand without that cap. So just be careful on this plan in that you want to start to stick towards generics where you have a $15 copay. In other words, you could owe 40 or 50% for a name brand. So this plan is far rich in terms of medical, nationwide coverage, and as such, it has a much higher premium. So we're going to continue to offer that plan for those that live outside New Jersey. Okay? As we continue the memo, just reminding you that at Studio Eagle, we're paying 100% of your single premium for the Omnia Silver. You can add your dependents. Our website, which I'm going to go over in a second, called Bernie Portal, helps you enroll. It's going to tell you you put in your dependent's name. It's going to give you a cost for spouse or children or combinations. It's also going to show you the cost difference to upgrade to the gold or the Advantage gold with Blue Card. Okay, so similar, same 3 plans that we offered last year, same contribution from the company. So that 8% increase that Blue Cross gave us, obviously Studio Eagle is paying that much more for your coverage. Okay, any questions so far on the 3 medical plans? For those of you that don't want to ask a question here, I'm going to remind you, but down towards the back, you'll see my name, Dan Toner, and my email address and my phone number. So if you ever think of any questions, feel free to contact me. Okay? So here's a reminder about how I check providers. If I go to horizonblue.com, for those of you that are covered, you should go in there and register. Get your ID number. You can print. If you lose your ID card, you can order a new one. If you get a bill and you're not sure what to do with it, go to Horizon Blue and download your explanation of benefit, EOB, that tells you if you owe a bill or not. Make sure you go on Horizon and check everything out. So please go on there. You don't need to register to check providers. You can just click the Find a Doctor button at the top right. Up comes the category of doctors. You would choose Omnia, and you could put locations, doctor's last name. You can choose different ways. For those of you that are in the Omnia, remember the physician is going to come back and it's going to say Tier 1 in blue or Tier 2 in gray, and that's how you know what your provider is, and that's how you know what level of coverage you have from the benefits. So horizonblue.com is a resource. Some great news on the dental. Again, this is paid by you, the employees. This is voluntary. Many of you are covered under Guardian, and Guardian is a great organization. It's just, in our opinion, their premiums got a little out of hand. They keep raising them up every year. So we were able to go to Delta Dental. Delta right now is probably the largest dental provider in New Jersey. Their premier network has 83% of the dentists in New Jersey participating. So most likely your provider is in-network. In-network is a good thing. It means that you're paying the discounted amount and the dentist can charge you higher. So the fact that they have a lot of dentists is a good thing. And also I want to point out, from a premium standpoint, this $45 a single is significantly less than the Guardian rate was. So these premiums are not only less, you have more providers, and more importantly, the maximum is $5,000 if you're using a PPO and $4,500 if you're using a Premier. So they give you 2 network of dentists to access, and at a minimum, you're going to get $4,500 worth of benefit. Today, that maximum is $1,500 per person. So they've obviously tripled the benefit that you can get every January through December. So starting in January 1, if you're covered under, we want you to go in to Bernie Portal when you make your elections and click on that you want to enroll, single, couple, family. You get to choose how you want to be covered. But everyone that's covered under Guardian right now, we're just going to transfer you over to Delta Dental come January 1 and get the better benefits. So that's good news for sure. Okay. We're keeping Guardian for the life insurance and the vision. For those of you that were interested in the vision before, they use a network called Davis Vision. Vision works in a couple of different things. You have a copay benefit. For example, you can go to an eye doctor. By the way, if you have a medical condition, glaucoma, diabetes, you go use your medical benefits for that. It's called a medical claim. If you just want a checkup for routine eye exam, that's when you need vision. So Horizon won't cover routine, they only cover medical conditions. So if you wanted routine eye care, you would pay a premium for Guardian under the voluntary vision. You get access to Davis Vision. Now you have in and out of network, but the benefits will be richer when you use a Davis Vision provider. Okay? You'll pay a copay to have your exam. You'll pay a copay for materials, and you have a cash reimbursement of $130. So they give you, whether or not you're having contacts or frames, they're going to reimburse you 100% of that 130. And I will tell you that they also give discounts on top of that. So many times when you purchase a pair of glasses, they'll tell you that you owe $25, let's say, for the actual lens. You're getting a cash reimbursement of $130 plus a discount off the rest of the frames. So ultimately, when you show your card, you could probably make an argument that at $2.78 a paycheck, you're probably well getting worth the value of a vision benefit. So you would show your card and you usually receive an awful lot more than the premium that you pay. Again, you can add spouse, children, dependents. It has nothing to do with your dental, has nothing to do with medical. They're all three separate coverages. So you don't have to match each of them. Okay, so these are the same premiums and the same benefits that Guardian offered last year. One reminder about the life insurance. Everyone can get up to $200,000 of life insurance on the Bernie portal. If you're not covered today and you want it, you'll just make an election, and there's sort of a drop, a bar at the end that you drag, and it'll show you the different premiums for if I want 50,000, 75, 100. You get to pick them in increments of 25,000. We'll take any requests. We'll send it into Guardian. They'll send you a life insurance questionnaire, yeses or nos. And if you get it, they'll be issued the policy and it's taken out of your paycheck. So we're going to offer that every year for those that are interested in life insurance. How you make elections and enroll. So we're using Bernie Portal. That's on my side. So this information from Bernie Portal goes direct to Debbie, my office manager, and myself. It doesn't go anywhere else. So we take down the information. If you can go, I'm going to turn Bernie Portal on tomorrow morning. So tomorrow morning, you're going to be allowed to go to www.bernieportal.com. You probably may know that your email is your login, and you guys have picked a password in the past. If you don't remember the password you chose, there's a little button at the bottom that says forget password. Just click it, and Bernie Portal will send you an email right back that just welcomes you, and you can just update your password. When you get in, just make sure your personal information is there, spelling of your name, your address, make sure your dependents are there. It doesn't mean you're covering your dependent, it just means that you have dependents. When you get to each screen, the medical, the dental, and vision, towards the bottom, it lets you pick and choose who you want to cover. And all the costs on the far right get updated as to whether or not you want to cover them or not. Okay, so please use Bernie Portal. That's a lot faster for us to collect it. We don't have to chase down paper applications. Bernie Portal will update all the applications that Debbie and I can send to the carriers for you guys. Okay? So just some reminders: Horizon's contact information, Bernie Portal is our enrollment, Delta Dental and Guardians, and then my team at the bottom is the very end on how to reach us. Okay? So that's my overview. I'll open it up to questions right now in case anybody has any questions for me. Amanda, Katie, I think, is it fair to say that we could pick maybe next Monday as a close date, give everyone a week to do their choices? Does that look good? Do we want to ask for Friday, give them a full week?
I think Monday sounds good. Does anyone have any problem with Monday? Full week to log in? All right, good.
Okay, the earlier the better. So if everyone gets done on there, we'll certainly start our process with starting the transition to Delta Dental, renewing the Guardian plan, and letting Guardian know if there's anybody new to life or vision. And with Horizon, we just have to notify them in about 2 weeks as to who is enrolling and what plans. This is your time to change coverages. So if you're on gold and you want to downgrade to silver, this is the time to do it. If you're on silver and you want to upgrade, this is the time. You cannot make a change during the year unless you have what's called a qualifying event, which is an involuntary loss of coverage. Okay, so that's all I had. And again, I'll just open it up just in case anyone has any questions.
Hello, Dan. It's Randall here. Quick question back to dental. Is there anything for orthodontics work?
I think we've stayed away from orthodontics, Randall, just because the premium, you're getting $1,000 of lifetime maximum with a lot of these carriers. So I think as we've quoted ortho in the past, we can certainly add that, but the problem it has is you're paying a premium times 12 months and you're making a commitment and they're only giving you $1,000 of lifetime benefit. So I think some of us felt that that's probably not worth the benefit. So when orthodontic is thrown in, that's the limitation.
Makes sense.
What I've personally found is if you go to websites like discountdental.com, there's a lot of services that provide you a very inexpensive benefit like $9 a month that have 50% off for braces, assuming that your dentist participates in those. So maybe if you want, because I get it, braces are $5,000. So if you want to take a look, maybe you ask the orthodontist, are there any discount plans that they accept? And you can go in and buy something relatively very inexpensive for a child, maybe $100 a year. And if you get a 50% benefit for a $100 premium a year, you take it. So you can talk to me offline about that, but I think that's a better strategy than paying a Guardian or a Delta Dental to get $1,000 max.
That's helpful. Thank you.
You're welcome. Or you have to work for an orthodontist. Yeah, that's a tough benefit. Having 2 kids that have gone through it, I certainly get that pain. Anybody else?
As far as the gold coverage goes, Omni Gold, is there the real advantages? Is it just on the copay and the savings and medication, or is there any other key things to be aware of there?
So if you look on the screen, I hope I pulled it up. You'll notice you're getting a couple things. We'll just top to bottom. Number one, your hospital and surgery and MRI deductible is decreased from $1,300 to $500. So if you know you're having hospital and surgery bills and MRIs and go to the emergency room, you know right off the bat you're going to save $800. Then number 2 is you're saving $20 every time you go to the doctor, $35 every time you go to the specialist. And then the bottom, what you mentioned, Mark, about medications, I only have a $40 or a $75 copay for a name brand drug. If I take a name brand drug that's $300, I know I'm going to pay a $75 max, maybe even $40, whereas I may owe 50% of it. So that's another reason to upgrade and pay. So it's really, it's sort of a lot of little things. The biggest thing is probably the deductible.
That's helpful. And we'll see the price difference on the portal. Is that what you said?
Yeah, absolutely. And it's just a math game that you'll do. Clearly it's if I do a price and I say it's $1,000 more, I don't know what the number is, but let's say it's $1,000 for a year for me. Clearly, I'm not going to give Horizon $1,000 more if the only thing difference for me is $20 to go to the doctor, and I take mostly generics. It's not worth the upgrade at all.
Right. That makes sense. That's helpful. Thank you.
Anybody else?
Yeah, Dan, I have a quick question. Do you know why they lowered the copay on the Omnia Silver down to 30?
Because so many people were annoyed with it going from 30 to 35, I think. And I think most of the competition has $30 copays. So I think that's probably, I don't know, I just assume Blue Cross representative hasn't specifically told me why they did it. But I'm going to guess it's a lot of squeeze from the competition, and they're trying to drive people to the primary doctor. And as that starts to creep up, that's a negative in terms of their product. So I'm surprised that they did that.
Got it. Thank you.
But a lot of the competition has $30 for a primary care copay. So I'm going to make an assumption that that's why they did that. Anybody else? Okay. So Amanda, you want me to I'll hit the stop record. This way, I don't know if I get it now or you get it now. And then if everyone can, Amanda, Katie, I'll send you guys an email. Just say, hey, can remind everybody to go to bernieportal.com. And again, I'll just do that one last reminder. When you go to Bernie Portal, there's a login button. And when you click it, use your work email. If it says that email is unrecognizable, maybe use a personal, because some people have changed their email. And if it's not either your work or your personal email, you're going to let us know, and I'll just put you back in there and reset you. If it recognizes your email, you're just going to click forget password. Bernie Portal will send you an email within seconds. Check spam, by the way. And then you can just click the login and continue. And if you're having any problems with that, you can let me know.
And this Bernie portal, this will open up tomorrow morning?
Correct.
Okay.
Thank you.
You're welcome.
Thank you.
I think the recording will save to your device, so you can.
Let me know if you have any questions. Have a good evening. Thanks for the opportunity.
Thank you.
Thank you.